Hello, class. Today I'm going to give you a lecture about the autonomic drugs. I hope you have watched and listened to the lecture of Dr. Nika Taloma. I think it's a very good lecture regarding the autonomic nervous system, and you need that. You need that to have an easier grasp of the autonomic drugs. Okay, along the way, along the course of our lecture, I will be mentioning a lot of terms from that lecture, from Doc Nika's lecture, and of course, I will re-explain the other concepts for you to understand better. Okay, so first we start with the autonomic drugs. You know that the autonomic nervous system is in charge of the involuntary actions, okay, like for example those of the heart, those of the gastrointestinal. For the heart, for example, it's an involuntary action, okay. The autonomic nervous system is in charge of that. It's not a voluntary action because voluntary actions, the system in charge of that is the somatic, okay. So now we proceed with the different classes of autonomic drugs. We start with the cholinesterase activating and cholinesterase inhibiting drugs. So if you have watched the lecture, you know that we have the choline from the word acetylcholine. We have the cholinesterase activating and cholinesterase inhibiting drugs. Ibig sabihin, these drugs, pag sinabing cholinesterase activating, it activates the choline receptor, okay? So drugs with acetylcholine-like effects, they are called also as the cholinomimetics. They consist of two major subgroups basing on their mode of action. One is they act directly on the acetylcholine receptor or indirectly through inhibition of cholinesterase. If you already know what cholinesterase is, I'm going to further explain, okay? Cholinesterase is the enzyme you need to break down your acetylcholine, okay? If you do not have your cholinesterase, of course, you will have high levels of acetylcholine kasi hindi mo siya mabe-break down, okay? If you want to have a cholinergic action, ibig sabihin pag cholinergic action, you're pertaining to the parasympathetic action, okay? Parasympathetic, it's the rest or digest action, alright? If it's sympathetic, you just remember this. If it's sympathetic, it's the flight or fight response, okay? If it's parasympathetic, it's the rest and digest action, alright? If it's parasympathetic, the receptor in charge for that is the acetylcholine receptor, okay? Now, kapag direct acting, ibig sabihin, it acts directly on the acetylcholine receptor. If it's indirect acting, it acts via the enzyme cholinesterase. Okay? So the drug now is going to inhibit the cholinesterase enzyme for you to have high levels of acetylcholine, which will be your ligand to be attached on the acetylcholine receptor for you to have cholinergic actions. And when you say cholinergic actions, again, they are parasympathetic actions. So you have to memorize, okay? You have to memorize the actions under sympathetic and the actions under parasympathetic. So we have a table for that, and you have to memorize that at your level. You really have to memorize, and of course later on be able to comprehend and understand. Okay. Now, drugs in the direct acting subgroup, they are further subdivided on the basis of their spectrum of action. Like for example, whether they act on the muscarinic or nicotinic cholinereceptor. Okay, for the cholinergic receptor, you can have the muscarinic receptor and the nicotinic receptor. So what's the difference between the two? When you say nicotinic receptor, all right, the action is more on the central nervous system, on the brain, okay, sa taas. When you say muscarinic receptor, When the ligand is attached to that receptor, ibig sabihin it acts more on the visceral organs. Okay, like for example, the peripheries, the GI, etc. Now, right? So under direct acting again, these direct acting drugs may attach to the muscarinic receptor or may attach to the nicotinic receptor or even both. Okay, we have drugs that attach both to muscarinic and to nicotinic receptor. Now under muscarinic, we have the choline esters like the acetylcholine, and of course we have those under the alkaloids, the pilocarpine. Now for the choline esters, we have acetylcholine, methacholine, carbachol, and betanicol. Right? Again, if it's an ester, I hope you remember your chemistry. If it's an ester, it is composed of both alcohol and acid. Okay? And when you have esters, you know that they have poor lipid solubility. Okay? Meanwhile, for the other subclass under the muscarinic drugs, you have your alkaloids. Our alkaloids, you know that they are naturally occurring. Okay? The naturally occurring alkaloids such as the pilocarpine, nicotine, lobeline, and muscarine, they are naturally occurring alkaloids and they have a good lipid solubility. Okay? Again, when you have drugs that have a good lipid solubility, ibig sabihin mas maganda yung penetration nila sa cell membrane. Alright? Next. For the indirect acting, you have these classes. Just to give you first an overview, we have the organophosphates. When we talk about organophosphates, they are very long-acting. We have an example, parathion. We also have the class carbamates. Under that, you have neostigmine. Carbamates are intermediate to long-acting. And when we talk about the short-acting, indirect-acting drugs, we have edrophonium. Okay, so iisa-isahin natin sila later on. Alright, so next we have this high-yield terms to learn. You have to know these terms first before we dig deeper into the other drugs, into the specific drugs. When we say choline esters, I've mentioned this already. A cholinomimetic drug consisting of an alcohol that's the choline or a choline derivative esterified with an acidic substance, like for example acetic or carbamic acid. And these choline esters are usually poor lipid soluble. Next, when we say cholinergic crisis, you may encounter this term. When we say cholinergic crisis, it's a condition wherein you have an excessive activation of cholinereceptors. Ibig sabihin, marami kang ligands na na-attach sa yung cholinereceptors. Or for example, too much of your drug, you have an overdose, marami siyang pinagbayad na receptors, and these choline receptors are activated. You have an excessive activation, and with these you have a response of skeletal muscle weakness as well as parasympathetic effects, usually caused by cholinesterase inhibitors. So the cholinesterase inhibitors are those drugs that are commonly causing cholinergic crisis. So we have also this term myasthenic crisis, okay? And then we have the clinical condition myasthenia gravis, wherein too much of acetylcholine receptors are activated. Next, cholinomimetic alkaloids. Aside from the esters, your cholinomimetics can also be alkaloids. They are drugs with weakly alkaline properties, usually an amine of plant origin whose effects resemble those of acetylcholine, and they are usually lipid soluble or with a good lipid solubility. Next, cyclospasm. When we say cyclospasm, it's a marked contraction of the ciliary muscle, maximum accommodation for close vision. Okay? So, some of your drugs kasi, some of your cholinomimetics, they act on glaucoma. Okay? And when we say glaucoma kasi, when you have a problem with the contraction. Okay? So, these drugs promote. Okay, some drugs promote marked contraction of the ciliary muscle. Okay, and they promote maximum accommodation for close vision. Next, you have the direct-acting cholinomimetic, a drug that binds and activates cholinereceptor. So that's very obvious. Ibig sabihin, direct, mismong sa receptor siya nag-act. Okay? Your drug attaches directly to the receptor and activates it. The effect mimics those of acetylcholine, okay? When you have less of acetylcholine itself, acetylcholine kasi is an endogenous substance in the body. When you have less of that, you need your drugs, okay? You need your drugs that mimics the effects of acetylcholine. And when your drug attaches to the acetylcholine receptor, if it's a cholinomimetic, then it's acting like an acetylcholine, okay? Next, when we say EDRF or endothelium-derived relaxing factor, it is a potent vasodilator substance, largely nitric oxide, that is released from vascular endothelial cells. Okay, that's just nice to know. Next, indirect acting cholinomimetic, it acts on the enzyme. It amplifies the effects of endogenous acetylcholine by inhibiting the enzyme acetylcholinesterase in charge for breaking down acetylcholine. Muscarinic agonist, it's a cholinomimetic drug that binds muscarinic receptors and has primarily muscarine-like actions. When we say nicotinic agonist, it's a cholinomimetic drug that binds nicotinic receptors and has primarily nicotine-like actions, more on the central nervous system. Myasthenic crisis, in patients with myasthenia or myasthenia gravis, there is an acute worsening of symptoms, usually relieved by increasing cholinesterase inhibitor treatment. Okay? Next, we have organophosphates. These are also cholinomimetic drugs, but under the indirect acting. It's an ester of phosphoric acid in an alcohol that inhibits cholinesterase. Organophosphate aging, a process whereby your organophosphate, after binding to the cholinesterase, is chemically modified and becomes more firmly bound to the enzyme. So that's called organophosphate aging. Parasympathomimetic, already know this, a drug whose effects resemble those of stimulating the parasympathetic nerves. Okay, so this next table, we have here the common cholinomimetics, their spectrum of action, meaning anong bang receptor ang tinatarget nila. Is it the muscarinic, the nicotinic, or both? And, okay, the pharmacokinetics, their pharmacokinetics. For the direct acting, we have acetylcholine. Acetylcholine can target both musca and nicotinic. Mamaya sasabihin ko sa inyo yung mga some actions, alright? Some actions kapag, for example, nagbind yung drug sa muscarinic receptor, ano bang mga actions pag nagbabind sa muscarinic receptor or sa nicotinic receptor? So, you have to remember this. Ang acetylcholine can bind to both. Pharmacokinetic, it is rapidly hydrolyzed by cholinesterase, your enzyme that converts is supposedly, and breaks it down. Now, the duration of action is 5 to 30 seconds, very fast ang duration, and it has a poor lipid solubility. For betanicol, it acts more on the muscarinic, your betanicol. Okay? So, introduce ko na siya dati. It is usually used for bowel and bladder incontinence. Alright? So, ang betanicol, remember that you're sa bladder, you have your if you remember your anatomy, kung naabutan yung man to sa anatomy, your bladder, it consists of the detrusor muscle in charge na mag-contract. For example, kapag kailangan yung mag-release ng ihi. Okay? So, your parasympathetic is in charge of that. There is a parasympathetic action in your uterine detrusor, in your bladder detrusor muscle. Okay? So, muscarinic, kasi it's a muscle. Alright? So, more on the muscarinic receptor ang betanicol. What's nice about betanicol, it's resistant to the converting enzyme, okay? To the enzyme that's inactivating it. It is resistant to acetylcholinesterase. It is orally active. It has a poor lipid solubility though. Its duration is longer, 30 minutes to 2 hours. Like carbachol, it's like a derivative, right? It's like betanicol, but it can also act on the nicotinic receptor. Pilocarpine, it is used in eye conditions, like for example, I've told a while ago, in glaucoma, patients with glaucoma. Pilocarpine can act on both. It is not an ester because it's a naturally occurring it is an occurring alkaloid, naturally occurring alkaloid. It has a good lipid solubility. Duration of action is 30 minutes to 2 hours. For nicotine, of course, it acts on nicotinic receptor. It is not an ester. It is longer in terms of DOA, 1 to 6 hours, and it has a high lipid solubility. For varenicline, nicotinic din siya. It has a partial agonistic activity at N receptors. It has high lipid solubility and very long siya, around 12 to 24 hours ang duration of action. So for example, when you need to give direct acting cholinomimetic to patients na with severe conditions or pag long bedridden patients, you can consider this drug. For indirect acting drugs, edrophonium, neostigmine, physostigmine, pyridostigmine, ecothiopate, parathion, and sarin, all of them act on both muscarinic and nicotinic. So trivial lang, your indirect acting cholinomimetics, they act both on muscarinic and nicotinic receptor. Okay? Now, for edrophonium, it is an alcohol quaternary amine. It has a poor lipid solubility, not orally active, 5 to 15 minutes, very short DOA. Neostigmine, it is a carbamate, quaternary amine with poor lipid solubility, orally active, and longer for 32 minutes to 2 hours or more na DOA. Physostigmine, same as neostigmine. So, pansin nyo, the tigmins, no? Yung mga nag-e-end ng mga tigmin, they are the carbamates class. Okay? For physostigmine, however, it's a tertiary amine. It has good lipid solubility. Okay? It's orally active and the duration of action is same with neostigmine, 30 minutes to 2 hours. So, ang pinagkaiba lang yung structure ng kanilang amines. Okay? And then, syempre, the quaternary amine, it has poor lipid solubility. Now, for pyridostigmine, it's also a carbamate, like neostigmine, longer duration of action, around 4 to 8. For ecothiopate, parathion, sarin. Remember itong mga to. These are organophosphate drugs. So, remember, usual kasi na case ito, mga organophosphate poisoning. No, usually, mga nasa insecticides din. They are containing parathion. They are containing also organophosphate chemicals. No, actually, yung mga insecticide, pesticide, they are organophosphates in chemical nature. So, for example, in patients with organophosphate poisoning, yung mga nag-suicide na uminom ng kanilang pesticide, usually yung mga farmer na depressed or because of financial problems, umiinom sila ng pesticides, the usual antidote for that is atropine. And atropine has an anticholinergic action. So, this is always asked in the boards in terms of organophosphate poisoning, what is the antidote? You should know that organophosphate, it's a cholino, okay? It's a cholinomimetic drug. It's promoting parasympathetic actions. And to reverse that, you have to give a drug that is sympathomimetic or anticholinergic, and that is atropine. So the answer for organophosphate poisoning, the antidote is atropine. Please don't forget that, okay? Now for ecothiopate, parathion, sarin, lahat sila organophosphates. Now, for the lipid solubility, ecothio moderate lang, parathion high, sarin very high lipid solubility. Okay? It's a nerve gas actually ang sarin. For ecothiopate, 2 to 7 days. Longer for parathion, around 7 to 30 days. And parathion, yan yung usually na nasa insecticides natin. Okay, so I have to discuss further, ano nga ba yung mga muscarinic receptors, ma'am, and nicotinic receptors? What are the importance of these receptors? Right? So, umpisahan natin. This is actually found also in your book. Please read that. So, pag muscarinic receptors, they are divided. These are G protein coupled receptors or yung GPCRs na tinatawag. So ang mga G protein coupled receptors, they can be inhibitory, kaya may G sub I, and then G sub Q kapag excitatory or stimulatory. Now, the G protein coupled receptors na muscarinic, they are divided into five subclasses from M1 to M5. Alright? So, the muscarinic agonists, they are parasympathomimetic. You already know that. They mimic the actions of the parasympathetic nerve stimulation. Okay, and you have 5 subgroups of those receptors from M1 to M5, and they have specific actions. For M1, it's a G protein coupled receptor na GQ, or ibig sabihin excitatory. And its action is more on CNS excitation and gastric acid secretion. Okay? Pag M2 naman, it's inhibitory or G sub I. More on inhibition of a certain action. Like for example, sa heart. Ang ginagawa pag nagbind yung drug sa M2 receptor, ibig sabihin its action on the heart and it's inhibiting cardiac action. Like for example, yung sa heart rate, it decreases heart rate. So that's an inhibitory action. For M3 naman, GQ siya. It's a GQ type of GPCR. It is excitatory. It acts on exocrine glands, smooth muscles, vascular endothelium. Like pag exocrine glands, it promotes secretion sa mga glands na yon. And then for smooth muscle, it promotes contraction of smooth muscle. Pag vascular, sa vascular, it promotes vasodilatation via the substance nitric oxide. Remember that nitric oxide is a vasodilator. So, kunwari may isang drug na nag-bind sa M3, okay, it causes excitation. Okay? Kung ang gusto mong action ay sa vascular, it can cause vasodilation. Now, for M4 and M5, these are not usually common, but they have CNS effects. Okay? And then for your nicotinic receptors, alam niyo na agad yan. Just to emphasize, they act on sodium, potassium current, depolarizing current, more on the CNS ang effects nila. Okay, you just have to remember the 5 different receptors for M1 to M5. Pag M1 and M3, those are excitatory, and also for M5 actually. So 1, 3, 5 excitatory, and for 2 and 4 it's inhibitory. Okay? So if you have some time to read your books, meron doon muscarinic mechanism. So you can also read that, because if I can remember sa M1 kasi, ang post-receptor mechanism niya, for example, ibig sabihin pag post-receptor mechanism, pag nag-bind na siya sa receptor, your M1 is able to increase IP3. Okay? Bakit? Ano bang importance ng IP3? Your IP3 evokes release of calcium from intracellular storage sites. Pag nag-release siya ng calcium, your smooth muscle, remember that calcium is in charge of contractility or contraction. Now, your smooth muscle is able to contract because of the release of those calcium, okay? Those calcium ions brought about or triggered by the increase in IP3, okay? May tinatawag din tayong DAG cascade or diacylglycerol cascade as post-receptor mechanism. Ano naman ang ginagawa naman ng DAG, okay? Pag ang M1 and M3 kasi, for example, kasi both sila nagkakos ng DAG cascade. Pag nag-bind ang isang drug sa M1, for example, or sa M3 receptor, ang nangyayari, yung muscarinic receptors na to, nagkakos sila ng coupling sa may phospholipase C. When you have phospholipase C, it's a membrane-bound enzyme actually. Nagre-release siya ng second messengers such as the DAG, diacylglycerol, and the inositol 1,4,5 triphosphate or the IP3. Pag meron ka na ng DAG, nagmo-modulate siya ng action ng protein kinase C. And when you have protein kinase C, it is an enzyme important in secretion. And then when you have your IP3 naman, it is an enzyme important in contraction. That's why I told you a while ago, pag M1 as excitatory, it can cause both gastric acid secretion, and for example, sa CNS, excitation, and for the glands also, secretion of the glands, exocrine glands, and then also smooth muscle contraction. But more on yung smooth muscle contraction, it's more on the M3. Now for M1, it's more on secretion. Okay? But either, basta increase in IP3 and increase in DAG, or pag may DAG cascade, you already know that it's promoting both secretion and smooth muscle contraction. And M1 and M3, they are excitatory. Okay? So I hope you understand that. Kasi before, when I was a pharmacy student, I really had a hard time understanding these things. No? Before, sa amin kasi, we are in charge of the reading. We are just given very short concepts actually. Very super summarized lang talaga. More on kailangan nabasa na namin. And then the lectures are directed really on the drugs. No, without the introduction. But I believe kasi in autonomic nervous system, you have to be familiar with the molecular mechanisms like that, with the receptors involved, with both the actions ng parasympathetic and sympathetic. You have to know your anatomy. You have to have a good background of anatomy and physiology. Okay? So please remember that. You can actually download marami yan sa internet para maalala nyo yung M1 to M5 para hindi na kayo mahirapan. Okay? Kasi for the mechanisms of actions, for example, this drug binds to the M3 receptor. So you already know that it has something to do either with secretion or contraction, smooth muscle contraction. Okay? So, class-specified pala dyan smooth muscle. Iba pa ang cardiac, iba pa ang skeletal. Okay? So, you have 3 types of muscle. We have the skeletal muscle, the smooth muscle, and the cardiac muscle. So, smooth muscle, usually saan sila nahanap? They are usually found on the gastrointestinal system. Okay? Okay, check this table. Kung mapapansin nyo class, mahilig kasi ako sa mga table. So, yung presentation ko, all of them, they are tables grabbed from Katzung. Okay? Just to share how I study when I was a pharmacy student and even until I went for medicine, of course, I read everything, but I put emphasis on the tables. I always go back to the tables because, di ba nabasa mo na? For your first reading, you just read it. You familiarize yourself with the terms. And then for the second reading, that's when you try to comprehend or understand. And then later on, you combine both the memorization and the comprehension. And the last part, you are able to explain it to yourself without even reading the book, and you try to apply it. Okay? You try to lecture it with someone else. You try to discuss it with someone else. No, not reading your book na. You're like just telling stories to one another. Ganun kasi ang maganda. Now, I always go back to the tables. I highlight them. I write on them. I encircle, draw in those tables. No, mas naalala ko kasi. That's why my form of discussing it to you now is through the tables. Okay? But of course, the context, yung mga texts, ini-incorporate ko din. Now, this table, it is also a nice table because it already summarizes the effects of cholinomimetics on major organ systems. Okay? So, these are parasympathetic actions, class. Your parasympathetic drugs may act on the CNS, on the eye, heart, blood vessels, bronchi. Saan ang bronchi? Sa inyong lungs, di ba? And the gastrointestinal, specifically acting on the motility and sphincters. And then the urinary bladder. I've mentioned already the bladder, the trusor a while ago. And then pwede din siya sa skeletal muscle and of course, your glands. Pag CNS, anong ginagawa niya? More on mga nicotine, di ba? It has complex stimulatory effects. It may cause elevation of mood, It may cause too much alertness, addiction. For example, for individuals that are nicotine naive, they often suffer nausea and vomiting on initial exposure. Okay, hindi nila matolerate masyadong nicotine. And then physostigmine is a great example. Okay, it can cause convulsions. And then for some, excessive concentrations may cause coma. So careful lang din sa pagbigay ng drugs acting on the nicotinic receptor. If you know that your drug is acting on the nicotinic receptor, you have to be very careful with the dose because you're dealing with the brain here. Now for the eyes, it acts specifically on the sphincter muscle of the iris, okay, and the ciliary muscle. For the sphincter, iris sphincter, it causes contraction or yung tinatawag na meiosis, okay? Ibig sabihin, liliit, okay? For example, our pupils, they are sized, for example, initially na 3 millimeters, and when you want them to contract, liliit sila, okay? Liliit sila when you give them. When you have, for example, a 3 millimeter pupil, and you want that to constrict, okay? Mag-meiosis or mag-contract, liliit siya, like from 3 to 2 for better accommodation, okay? But the muscle specifically in charge for accommodation is the ciliary muscle, no? So your ciliary muscle, parasympathetic drugs can cause contraction of the ciliary muscle for better accommodation for near vision, okay? Yun nga, cyclospasm. You also call that cyclospasm. Next, for the heart, for the SA node, if you know your anatomy and physiology, the SA node is in charge of sending electrical impulses, okay, for conduction of the heart, for conduction of proper heart functioning. Now, your SA node, ang ginagawa ng parasympathetic drugs dyan, dinidecrease nila ang heart rate, okay, or it's called negative chronotropy. Pag when we talk about heart rate, okay, since we're talking about rate here, rate is synonymous with chrono, diba? So, kapag chronotropic drug, okay, when you have negative chronotropy, you're decreasing the heart rate. When you have positive chronotropy, you're increasing the heart rate, okay? But note, important reflex response in intact subject, okay? So, you can disregard that. Gusto ko lang tandaan nyo, SA node, it causes a decrease in heart rate, okay? Sa SA node, pag nag-act ang parasympathomimetic drug sa SA node, it causes a decreased heart rate. So, sa ma'am, saan ba nagagamit yung mga to? Of course, when you have patients that are tachycardic, okay, yung mga mabibilis yung heart rate, yung mga may increased heart rate, you do not want that to happen to your patients because they might go to arrhythmia, okay, magkakaroon ng irregular rhythm, okay, then after arrhythmia, may cause cardiac arrest, no? Hindi na kaya masyado ng heart because the rate is too fast for beating, hindi na ma-accommodate ng heart, okay? So, ang gusto mo, pabagalin yung heart rate, of course, in patients with tachycardia. Ang bibigay mo, okay, it's a parasympathomimetic drug, okay? So, next, for the atria, decrease in contractile force, you call that negative inotropy. Pag inotropy naman, it talks about the contraction. Contraction, ibig sabihin pumping of the heart, okay? Okay, you need to pump the heart, okay, para mag-feel siya. Because in the atria, if you remember again your anatomy, you have your right atrium and your left atrium, right? In your right atrium and left atrium, diyan nagkakaroon ng blood filling, okay? Ng blood filling ready to go into the ventricles, okay? And then for example, from the right ventricle, pupunta sa pulmonary. And then your pulmonary veins will be able to oxygenate the blood, okay? So, from deoxygenated to oxygenated blood, and then the oxygenated blood will go to the pulmonary arteries, and then from the pulmonary arteries to the left atrium, to the left ventricle, and then to the aorta, and from that, pupunta na siya sa different vessels, papunta na siya sa different parts of the body, okay? Pupunta na siya sa systemic circulation. So, sana alam nyo na yon, okay, class? Basta pag Pag parasympathomimimetic, it may act on the atria. Okay? It is in charge of decreasing the contraction. Pag masyadong mabilis yung contraction. Okay? So, kailangan mo kasi ng time. Okay? You have to give the heart time to fill and pump. Okay? So, for inpatients, for example, na masyadong mabilis, no, na hindi na nakaka-flow ng mabuti yung blood. For example, nagpa-pump na siya ng blood papunta sa system, papunta sa systemic circulation. Meanwhile, kukunti pa lang yung blood na na-fill sa may atria. So, you may want to decrease the contraction. And when you want to decrease the contractile force, you can give your parasympathomimetic drug. Alright? Now, for AV node, it's after the SA node kasi, it goes to the AV node. The electrical impulse goes to the AV node, and then after that to the bundle of His, and then to the left and right bundle branch, and then after that to the interventricular fibers. Okay? So from SA node, pupunta yung electrical pulse. You need to have your electrical impulses kasi for proper contraction of the heart. Now, your AV node, ang ginagawa ng parasympathomimetic drug is dinidecrease niya ang conduction velocity. So, pag tinawag naman natin conduction, it's called dromotropy. Okay? So, yung both, actually three. The rate, the contraction, and the conduction, your parasympathomimetic drugs are in charge of decreasing those modes, okay? Those mechanisms. Because, para hindi rin masyadong mapagod ang heart. So, it has to rest. That's why your parasympathetic is called rest and digest. Okay? Now, your ventricles naman, you know that you have the right and the left ventricles. Your ventricles, if you want to have a small decrease in contractile force, you can also give parasympathomimetic. Now, for blood vessels, the parasympathomimetic or cholinomimetic, okay? Mas mabilis ang cholinomimetic. Pag cholinomimetic, they can also dilate the blood vessels via the release of EDRF, so the endothelium-derived releasing factor from the endothelium. Okay? Pag merong release ng EDRF, meron ring release ng endogenous substance such as the nitric oxide, and that is responsible for vasodilation. Okay? Why do you need vasodilation, class? Ibig sabihin ng vasodilation, pinapaluwang mo, no? Pinapa-widen mo yung blood vessels, and when you want your blood vessels to widen, you want to have good flow. Okay? Minsan kasi the counterpart of it is vasoconstriction. Alright? So, pag vasoconstriction naman, masyadong narrowed ang iyong blood vessel. And when you have a narrowed blood vessel, of course, your blood flow is being impeded. So, you want that na paluwingin para mas maganda ang blood flow. So, if you want vasodilation to occur, that would be an action of the cholinomimetic drugs. Okay? On the other hand, if it's vasoconstriction, it's the sympathetic. Now, for bronchi contraction or bronchoconstriction. Bronchi, your bronchioles, okay, they are part of your lungs, of your respiratory system. Now, ito usually, hindi siya significant for me in the parasympathetic. We have kasi parasympathetic drugs. You have the beta agonists. These are sympathomimetic drugs, okay? These drugs are in charge naman for bronchodilation. In patients with asthma, ang problema kasi sa kanila, contracted, masikip ang kanilang mga bronchioles, kaya obstructed ang flow ng air. Now, if you want your patient to have a better airway flow, kung gusto mo mas maganda ang pasok, kunwari may obstruction, masikip yung bronchiole, kung gusto mong paluwingin konti ang bronchi, you can give sympathomimetic drugs. Okay? The parasympathetic action is bronchial constriction, okay, or bronchoconstriction, and the sympathetic action is bronchodilation. Now, for GI tract, parasympathetic, basta pag sinabing parasympathetic, they are in charge of secretion. Alright? And of course, motility. So, if you want to promote motility, good digestion, okay, you need your parasympathomimetic drugs. Now, they increase smooth muscle contraction. Okay, of course, pag nagko-contract ang yung smooth muscle, okay, Na-imagine nyo ba? Contract, ibig sabihin, parang kinocompress niya. Something like that. Okay? Pag contraction, parang mas pinapasikip niya, ini-squeeze niya. Okay? So, if you want na magandang digestion mo, you have to have an active, smooth muscle. Okay? In the GI area. So, pag continuous lang yung contraction, yung pag-squeeze, maganda ang digestion, magandang motility. Alright? So, in parasympathomimic drugs, they promote motility by increasing smooth muscle contraction or yung tinatawag nating peristalsis. Alright? Now, for the sphincters, they decrease the tone. Okay? They decrease the relaxation. Why do you have to decrease the relaxation? Okay? Diba? What do you call this one? Ang kabaliktaran ng relaxation is contraction. So, you want your sphincters to contract. No? Para magkaroon ka ng release ng digestive juices mo, okay, yung sphincters in your gastric area, you want them to contract during digestion, during peristalsis, para makarelease ka ng digestive juices mo, which will help during digestion. So, you have to decrease the relaxation of sphincters. You need them working during these times. So, to promote their work, to promote contraction and decrease the relaxation, you have the parasympathetic drugs. Next, for urinary bladder, yung detrusor, sinabi ko na, increase in contraction para makaihi. And then the trigonal sphincter, relaxation naman. Okay? So, yung trigonal sphincter, sila yung nasa baba. Okay? Detrusor kasi siya yung sa upper muscle ng sa bladder, and then yung sa baba na yung trigonal sphincter. So, for the parasympathetic, since it promotes voiding, okay? So, i-contract niya yung detrusor, yung sa may upper muscle ng bladder, okay? I-squeeze niya para magbukas yung trigonal at saka sphincter sa baba and makaihi yung pasyente. Alright? So, a famous drug for these actions, we have the betanicol. Okay, betanicol is a good drug used for bladder atony. Atony, ibig sabihin walang tone, no? Hindi nagwo-work ng mabuti walang muscle tone, hindi nagwo-work ng mabuti yung pag-contract at pag-relax ng both detrusor and trigonal sphincters sa may urinary bladder. You call that bladder atony. So, in patients with bladder atony, for example, yung mga patients na may problema sa spine, you know that your spinal nerves, they are responsible for some actions din sa bowel and sa bladder. So, for these patients na may problems din sa spine, some of them, hindi na maayos yung pag-ihi, hindi na nakokontrol yung pag-ihi at saka pagtae. And some have bladder atony. So, in patients with bladder atony, we give them parasympathomimetic drugs such as betanicol. For skeletal muscle, activation of NMN plates, okay, of course, promotes contraction. And for glands, it increases secretion, okay, like in terms of thermoregulatory sweating, lacrimation, salivation, bronchial secretion, and GI glands. Okay, check this. Alright, so finally, we are arriving at the main, okay? The highlight of this lecture, the drugs. You have the direct acting again, and then the indirect acting. Okay, so rundown tayo. For direct acting, we have muscarinic and the nicotinic agonist. Agonist, ibig sabihin, ginagaya nila yung effect. Okay? Ginagaya nila yung effect. So, kapag direct acting, we have examples here is betanicol, pilocarpine, and muscarine. For betanicol, it activates M receptors. It increases IP3 and DAG. Remember, IP3 and DAG. DAG is for secretion and IP3 is for contraction. Now, the action, more on, okay, it's indicated for bladder and bowel atony. For example, after surgery or spinal cord injury. Pharmacokinetics, it may be given oral, also IM. It has poor lipid solubility, okay, because it's a choline ester. It does not enter CNS. Its duration is from 0.3 to 2 hours. All parasympathomimetic effects, the toxicity can be cyclospasm, diarrhea, urinary urgency, plus vasodilation, reflex tachycardia, and sweating. Okay, for pilocarpine, same as betanicol, may also activate EPSP via M receptors in ganglia. Now, it can be used for Sjögren's syndrome, ibig sabihin increased salivation. Okay? Pag may increased salivation, you want, Sjögren's syndrome, it's a disease na meron kang dryness, no? Meron kang dryness sa mata, okay? And then, meron ka ding dryness sa mouth. So, you want na mag-increase ng salivation, mag-increase ng tears, you can give your pilocarpine. Remember that they increase secretion, no? Mga parasympathomimic drugs. Also, pilocarpine can be used for glaucoma because it may cause miosis and cyclospasm. It can be given orally via IM. It has a good lipid solubility. It's a naturally occurring alkaloid. It can also be given topically sa eyes. Similar effects, toxic effects sa betanicol. Okay? Also, it may cause vasoconstriction. Alright? For muscarine, same pa rin as betanicol. It's actually an alkaloid found in mushrooms. It has low lipid solubility but readily absorbed from the gut. The mushroom poisoning, it is a fast onset type, so be careful with that. Next, the nicotinics. Nicotine activates all nicotinic receptors, opens sodium-potassium channels in ganglia and neuromuscular end plates. It can be used for smoking cessation. So this can be asked in your board exams or whatever pharma exams you may take. Nicotine is best for smoking cessation. And it can be also used as an insecticide. It has high lipid solubility, absorbed by all routes. For smoking cessation, it can be given gum or transdermal patch. Duration is 4 to 6 hours. Okay? So, ang side effects or ADR is generalized ganglionic stimulation, hypertension, tachycardia, nausea, vomiting, and diarrhea. Major overdose, it may cause convulsions, paralysis, and coma. Pansin nyo, these are all CNS effects, no? CNS overdose effects. Now, for varenicline, partial agonist at N receptors, it can also be used for smoking cessation. If you are asked, aside from nicotine, what is used? What is that direct-acting nicotinic agonist used for smoking cessation? You can answer varenicline. It has high lipid solubility, can be given orally. Duration is around 12 hours. May cause hypertension, sweating, sensory disturbance, diarrhea, polyuria, and menstrual disturbance. Now, for succinylcholine, it is an N receptor agonist, moderately selective for neuromuscular and end plate. It causes muscle relaxation. Okay? Succinylcholine class, remember, pag muscle relaxation, it is an action of succinylcholine. Okay? Your succinylcholine, however, it may cause cholinergic crisis. Okay? Remember that. It may cause, pag na-overdose ka, extreme muscle spasms, post-op pain, kasi usually ginigive siya for patients under surgery. Okay, to relax the muscles because you want your patients to be relaxed during surgery. So our anesthesiologists, they usually give succinylcholine. However, they have to be worried about the muscle spasms at saka yung sobrang sakit, okay, na adverse effect niya. It is highly polar. It is used IV. Duration is around 5 to 10 minutes. Prolonged action in persons with abnormal butyryl cholinesterase because it's the one that's inactivating it. Okay? For indirecting acting, we can have the alcohols such as the hydrophonium or the carbamates, yung mga tigmins, neostigmine, pyridostigmine, and physostigmine. For hydrophonium, it is an inhibitor. Remember, all are indirect acting. They are inhibitors of the enzyme cholinesterase. Okay, kaya sila indirect kasi hindi sila nag-act directly on the receptor but rather acting on the enzyme. For hydrophonium, okay, inhibitor of cholinesterase, amplifier of endogenously released ACH. Same with neostigmine, pyridostigmine, physostigmine. Lahat sila inhibitors of cholinesterase and they amplify the endogenously released ACH. Okay? So, meron na silang ACH dati, okay? Ang gusto lang nilang gawin, ayaw nilang ma-breakdown yung ACH. Kaya ininhibit nila yung enzyme na magbe-breakdown or mag-inactivate sa acetylcholine. Your edrophonium, it can be used for reversal of neuromuscular block by non-depolarizing drugs. Diagnosis of myasthenia gravis. So, you use edrophonium to diagnose myasthenia gravis. So, yung kapag sinabi nating non-depolarizing drugs, example ng mga yan, yung mga pancuronium, rocuronium, drugs ending in curonium, which I will later discuss these drugs, okay? So, ang inyong antidote for those kapag nagkaroon ng toxicity from non-depolarizing drugs, ang antidote is edrophonium, okay? Diagnosis. When you want to diagnose a patient with myasthenia gravis, you also use edrophonium. This can also be asked in your boards. For diagnosis of myasthenia gravis, we give edrophonium. It is highly polar, used IV 5 to 10 minutes. Increased parasympathetic effects ang kanyang toxic effects, especially nausea, vomiting, diarrhea, and urinary urgency. Now, yung mga carbamates, again, mga tigmins, please don't forget these. Neostigmine can be used to reverse block ng mga muscarinic nicotinic receptors, treatment also of myasthenia. Okay, for myasthenia gravis, please highlight this. We can give na treatment is neostigmine. Pag gusto mong i-diagnose, you can give edrophonium. But for the treatment, mas maganda yung neostigmine. Okay, pyridostigmine can also be used for treatment. Now, for the reversal of atropine poisoning, your anticholinergic, you give a cholinergic such as physostigmine, given via IV and occasionally used in acute glaucoma as a topical agent. Okay, so just look on the pharmacokinetics. Moderately polar yung mga yan. For physostigmine, it's lipid soluble. 2 to 4 hours, 4 to 8 hours, usually 2 to 4 hours. Ganun ang mga tigmins. Okay? Of course, watch out for CNS effects like seizures sa physostigmine. Now, for the indirect acting organophosphates, you have parathion, malathion, serine, tabun, and others. Same action silang lahat yan. Basta indirect acting class, wala na kayong isipin. It inhibits the acetylcholinesterase enzyme. Ang parathion, it is used in insecticides. Duration of action is days to weeks. It is highly lipid soluble. That's why kaya niyo mag-cross ng brain, okay? Because in your brain, di ba, the barriers in your brain, highly soluble, lipid soluble. Now, that's why it can cause coma. Your insecticide poisoning, this is a highly dangerous insecticide actually. It may cause all parasympathetic effects plus muscle paralysis and coma. For malathion, can be also found in scabicides as a topical agent. Duration for days. It is also highly lipid soluble but metabolized to inactive products in mammals and birds. Just nice to know. Much safer siya than parathion. Okay, but definitely not allowed to be taken. Both of them cannot be taken, okay? Kasi extreme ang parasympathetic effects nila. Now, sarin, like parathion, it's a nerve gas. Usually, ginagamit ng mga terrorists yan. So, pwedeng tanungin din sa boards ninyo yung sarin. It's a terrorist weapon. More rapid action siya and it is rapidly lethal. Now, for Alzheimer's disease, you have this indirect acting drugs. Okay? So, tinatanong to, which drugs are used for Alzheimer's disease? Or what is the action of your drugs used in Alzheimer's disease? These drugs are indirect acting cholinomimetic drugs. You have rivastigmine, galantamine, donepezil. Tacrine is already obsolete. I think there's a mnemonic for this, so you can search on that. This 4, okay, pero tacrine kasi is obsolete na. But for learning purposes, itong 4 usually ang ginagamit for Alzheimer's. They promote cholinesterase inhibition plus variable other other effects na hindi pa clearly understood. Now, mainly used for Alzheimer's, they are lipid soluble. That's why they can enter the CNS. Half-lives is 1.5 to 70 hours. They may cause nausea and vomiting. So, yun class. Those are the cholinomimetic drugs, okay? Both direct-acting and indirect-acting parasympathogenic drugs. Okay, very good.